Hey, this is Michelle coming at you. Let's talk about medications to prevent type 2 diabetes. There are some medications that are out there that what they do is to treat type 2 diabetes is they give you an injection. And what that injection does is it lowers your blood sugar. And they pair it sometimes with you eating healthy as well as your physical exercise, right? So you have the injection and you have the physical activity and you have your nutrition, and presuming your nutrition is you're eating healthy. So all those together is supposed to lower your A1C and to help you with your type 2 diabetes, okay? But what some of them don't say is that by taking that particular medication, it might cause blurred vision. It may cause severe stomach and bowel problems. It may cause acute kidney injury. It may cause vomiting. It may cause depression. There's a host of other things that it may cause. And you just have to really, let's just think about, ask yourself, is this something that I really want to take to prevent type 2 diabetes? Because there's other methods that can also lower your A1C or your blood sugar. And for those who don't know, your A1C is how they test to see what your blood sugar is, to determine whether you're diabetic or not. So a person who's pre-diabetic, they go from 5.7 to 6.4. That's when you're pre-diabetic. Anything beyond 6.4, they put you in a classification of diabetic or having diabetes. However, if they just test you one time, then that doesn't necessarily mean that you're diabetic. It's just at that point your blood sugar was that high. However, what they'll do is monitor your blood sugar over time to really determine and if it stays up to 6.4, then they may say that you're diabetic, and that's how they determine it. So, with that in mind, if by taking this medication, because some medications are, from my understanding, and I know that certain medications are injections. We all know with medications, there's more likely going to be side effects. And sometimes the side effects are actually worse than the actual situation you're going through. If that's something that you want to do, that's fine and dandy. But there's always other routes that are more natural that can be helpful with you lowering your type 2 diabetes. I know this because I'm a health educator. So that's why I'm bringing it to you as far as lowering your A1C, or if you're pre-diabetic, other ways to do it outside of taking medication. So if you lose between 4 to 5% and sometimes more of your body weight, but let's just go for 5% of your body weight, that could also lower your A1C. And also just really watching what you eat as far as like your junk food and all that stuff that, that's just not healthy for it, and you know it. Just decreasing that and increasing your physical activity. They suggest having at least 150 minutes a week of moderate activity. And I mean moderate. That means you're not just walking leisurely. That means you're getting your heart rate up, right? So, but really that moderate activity may depend on your physical disposition. So you'd have to really determine that and have to talk to your doctor about that. But I'm just saying that you really don't always have to use medications to lower your A1C if you're able to do it naturally. Sometimes I understand that we need a little boost. However, those little boosts can cost you your life, right? So I hope this information is helpful, and you take care.